The electronic medical record is really a future for all hospitals, and really it's just a matter of when. The explosion in our country of technology, the Blackberries and the Facebooks and the Twitters and all the things that we live with are indications that our future is very tied up in technology. So we haven't always been good in the hospital business about keeping up. And in the case of putting all of our medical records onto a computer, most hospitals have yet to do that. In fact, we're at TMC in a very small percentage, less than 5% of hospitals in the country, who are now on an electronic medical record in which all charting and all order writing is done on the computer. It's a wonderful thing, and it's been a very difficult thing. We've prepared for it for 18 months. We knew that it was going to rock our lives and change our world, and in fact it has. We had a countdown the night that we cut over from our paper system to our electronic system on Memorial Day 2010. And we were very, very pleased when everything worked at 4:03 in the morning.
The one reason, the most important reason, the only reason as far as I'm concerned, we're doing all of this relative to electronic documentation is for patient safety. There's really no other reason. It's not to get market share, it is not to engage staff, it is not to get our names in the paper for doing this first. It is to keep patients safe, or safer in a way that they haven't, that we haven't been able to before. And the reason that we're able to do that is because we have so much more information available to folks at their fingertips, real time, that we never had the opportunity for before. One, there are a couple of things that come to mind when I think about challenges in the healthcare system around caring for individual patients. And the first one is what we consider, or what we call in healthcare, the handoff. What happens when a patient goes from one provider to the next? How is information transmitted or translated? And the literature shows us that most errors in treatment are made around this problem in the handoff. The right information, or all of the information, isn't appropriately communicated. Electronic documentation really takes that whole problem out of the picture because we have all of the information there all the time when the patient is sitting across from us. So we know what their history is, we know what's been done previously. So not only will it keep the patient safe, and in this instance I just described to you, it'll also take waste out of the system. We won't continue to order tests that have already been done, that kind of thing. But again, going back to this handoff issue, equally as important. Physicians come in the hospital for a day, then they're off for a few days, so how does their partner know what's going on? Well, all of the information is presented to them or available to them in a different way than it was before. Nurses work 4, 6, 8, 12 hours a day, and they hand off to the next shift of nurses. It allows them to provide complete and accurate information about their patients all of the time during that handoff period.
Communication has gotten a lot better between doctors and nurses because everything's right there, right when it's entered in. I've definitely seen an improvement because it flows better. When you go in, you can see the doctor's progress note right in there, what the plan is, what the orders are. Meds come up right away because the process of scanning the pharmacy having to read it doesn't have to take place anymore. It just goes directly in, and it's a lot faster. Results come up faster, and just all around better patient care, I think, that flows.
I think we all are finding it good. We're liking it. It's saving time, and everybody's parties, like with physical therapy and doctors. Nobody is fighting for charts anymore. And I think it's just making it a whole lot easier as far as taking care of the patient and being right there at bedside and providing the care that we need to provide for them. So that's what I like about it.
I think in the TMC world, they've been living electronically in paper for a long time. And it's been painful. It's not been so much painful for the physicians, but the rest of the system. Reviewing charts for chart review, med reconciliation, prescriptions, follow-up. TMC's basically been electronic except for the physician piece for the last few years. And we really just had to make the jump to the total electronic medical record. And that's one of the reasons it impacts physicians so much, because everyone else was doing it. I think the major benefit for TMC is it totally reinvents the way we take care of patients. We shone a light in every corner. Every piece of paper was looked at. Everything anybody does in this hospital was analyzed and transferred to the electronic record. So it's not just the electronic medical record, but how TMC does business, what people do, what tools do they need to do their job. And I think that's an important step forward. It's the 21st century. These are the things we have. We have a commitment to the community for communication to patients, communication to the physicians in the community, to our referral base in 2 states. It's important that we do this.
I've been at Tucson Medical Center for almost 35 years, and obviously in that time I've seen a lot of changes. And this is a huge change. It's a brave change, but it was really, I was impressed at how smoothly and easily it went. I gave the first anesthetic and charted the first anesthetic on OneChart here, and I was nervous. It was kind of scary, you know, you're afraid you're going to screw something up, but the fact is it was pretty intuitive and went very, very well. I'm convinced, having used it now for a couple of days, that very shortly the anesthesiologist will say, you mean I have to keep a paper record? I mean, it's so much less labor intensive in terms of record keeping.
You know, I've seen a lot of people coming together and helping other interdepartmentally, the anesthesiologists and the nurses working together, really just helping each other along, sharing information, getting it all integrated. Of course, the first few days, the learning curves have been pretty steep, but as we move forward, you can see that the access and the completeness of the medical record is above and beyond what it was, and the access to be able to obtain your results and just look at different data from different areas of the hospital about one patient. It's all right there at your fingertips, and it's been very helpful in that regard.
I'm a nurse at TMC and Cardiac Medical. We recently started the OneChart process, and what I've noticed so far at the last couple of days were that patient care is more streamlined. We have more interaction with the physicians and the other nurses or other departments with scheduling. Let's see, the patients seem to be a little bit more satisfied with how quickly things are turned around with the procedures. As a whole, the unit is actually working great. We've got people who have taken specialty classes. We had to take the specialty classes before, but there's others that took advanced classes who are on the unit to help us. And the situations that we have is just expanding our knowledge, and the patient care issues that we were having before will be taken care of by this process. Everything will be taken care of maybe by 1 or 2 people instead of a long process where there's 5 people that can get things mixed up.
Today is the 3rd day of using the new electronic medical record here at TMC, and it's going pretty well, I must say. I have been looking forward to this for a very long time. I've been in practice here for 2 years, and I trained at hospitals that had electronic medical records, so I have been looking forward to getting rid of the paper chart. Doctors' handwriting is notoriously very bad, and it's always been a little bit of a struggle to keep up with a medical record with a huge patient load and trying to read handwriting and things like that. So I've seen a big change in the ease of physician communication already. Every single note is legible, it's in a timely manner, you know who wrote it, you don't have to figure out what the signature is, so that's made some things immensely easier. And the thing that I've been most impressed with is that every single time I've had to pick up the phone and call the help desk, it's been less than a 10-second wait. They've addressed my concerns almost immediately, and the ones that take a little bit more work, they've taken my cell phone and called me right back. So I think that the effort is really a huge undertaking, and I think it's going as well as can be expected.
So I think the main thing is that the TMC administration has been willing to make this kind of investment, not only financially but socially, for all of us to be taught how to do this. And it's just the most wonderful program. It's a time saver. It makes everything so much more legible. We can read the orders very quickly. We never have to worry about trying to make sure that we've got the right doctor's signature. And it's fabulous. I can't say enough about it. It's just really wonderful. And I'm so proud to be part of this, truly.
There was a lot of anxiety in the lead up to go live, a lot of anticipation, but when we finally went live, the impressive thing was how much everyone knew already, and which enabled them to take off on OneChart. There's so much collegiality and professionalism and people working together. That was very, very impressive to see. It's been, I think, way, way better than anyone ever expected. And I think we're all excited that over time, 6 months to a year from now, we're going to look back and accept this as the way, and it's going to be a better place.
Our care hasn't changed. Our patients are still being cared for individually, one patient at a time, by one caretaker at a time. That's the great news. The other great news is that with everything that's been put together for healthcare reform, with all of the changes in our country, this electronic system gives us information that we never had before. We can aggregate data, we can judge how well we're doing over large groups of patients, we can look at the population that we serve, and we can learn how to serve them better, more efficiently. We can look at medications to see if they're working, what they're doing to the patient's length of stay. And as you heard from Linda, our Chief Nursing Officer and our Chief Operating Officer, we are getting a lot of information that gives us great reassurance about our patients' safety.
And it's going to be painful initially for physicians as we learn these new tools. We crawl, we walk, we run, and that's the goals at TMC. Is that good?